In China, there's been a surge of cases of pneumonia and hospitalizations, mainly in kids. And they attribute it to viruses and a bacteria called Mycoplasma pneumoniae, which is also known as walking pneumonia. Unfortunately, 70 to 90% of their cases are resistant to antibiotics. So what can we do? Well, it starts with prevention. Make sure you're washing your hands, avoiding touching your face, avoid crowds or wear a mask, especially if you've been sick or exposed. Look out for symptoms: headache, sore throat, cough, fever, fatigue, and test, don't guess. There are tests that your doctor can do to see if it's a virus, which doesn't need antibiotics, or if it is a bacteria like Mycoplasma. Now, my favorite supplements through the winter season are vitamin D, vitamin C, omega-3 fats, a probiotic, and zinc. But talk to your doctor before taking supplements. And always work on a healthy gut, a healthy immune system, and get plenty of rest and hydrate this winter.
Walking pneumonia in kids. We're seeing these headlines everywhere. Dr. Daria here, board-certified ER doctor, mom of 3. Here's what you need to know and why you also don't need to panic. So first, what is walking pneumonia? It's just a milder form of pneumonia or infection in your lungs. And instead of, having to be laying down in a hospital bed, you can be walking or outpatient and be treated for it. Number 2, we see cycles every 3 to 5 years. So we happen to be in a peak year. 3, it's caused by a bacteria, Mycoplasma. That means that unlike viruses like the flu, ding, 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 yes, antibiotics actually work in these cases. What are the symptoms? It often begins slowly, maybe a mild fever, maybe not feeling so great, and then develop runny nose and a cough, and that cough can last 7-10 days or longer. They also may get muscle aches or pain in their joints. Now, about 25% of kids will get symptoms outside of the respiratory tract, and those are often the symptoms that kind of clue me in as an ER doctor that, hey, we might be dealing with Mycoplasma or other cause here. Those can include rash on the skin, blisters inside the mouth, or redness of eyes. So if your kid has any of those, coupled with respiratory symptoms, definitely a sign to go see your pediatrician. Again, most kids will just have mild cases. We just happen to be in a peak year, which is why everybody's talking about it. Talk to your pediatrician if you think your child might have Mycoplasma pneumonia so they can get treated, and read the caption for red flags or signs of more serious complications. Follow along to know how to prevent accidents, illnesses, and injuries in your kids, and know what to do when they are.
Walking pneumonia is on the rise. What symptoms should you be looking out for? So walking pneumonia is usually caused by a bacteria called Mycoplasma pneumonia. And the reason it's called walking pneumonia is that people are usually walking around acting pretty okay. They may have a little fever, maybe a little more fatigued, but they just have this dry, rough, continuous cough. So often kids are still at school, parents are still at work, and they're coughing and they're spreading their germs to others. That's why these are called community acquired pneumonia. So if you or your child, and it's more common in school-aged kids, but we're seeing it in younger kids as well now, have a cough for more than 5 to 7 days that isn't improving and just keeps going, or you have a fever for more than 3 to 5 days and it's not getting better or going away, then please see your pediatrician. We can sometimes diagnose by listening to the lungs. We hear certain sounds. We can also do a nose or throat swab and test it at our office or send it to the lab to pick up the specific type of infection. And if it shows Mycoplasma pneumonia or other types of bacteria that need antibiotic treatment, then usually we do need to treat you. Now, first line for Mycoplasma is usually Zithromax. That said, we're finding that a higher dose of Zithromax, sometimes for even longer, is usually needed. So always go back and see your pediatrician a day or 2 after you start treatment if your child isn't getting better, so we can recheck and follow you up to make sure that you are improving and you're not sharing your germs with others in the community.